The Cleveland Clinic says a resident who made a series of anti-Semitic posts on social media has now been fired. In 2012, Laura Koleb tweeted that she would, quote, purposely give all the Jews the wrong meds. She also referred to Jews as dogs, called for their homes to be destroyed, defended Hamas, and claimed that Jewish losses and victimization in the Holocaust were exaggerated. Koleb has since deleted her social media accounts, but Ohio state records show that her medical license is still active until mid-2021. All right, let's go deeper with Dr. Arthur Kaplan. He is the founding head of NYU's Medical Ethics Division and joins us via Skype from Ridgefield, Connecticut. Thanks for being with us, Dr. Kaplan. We have a situation where you have a doctor here saying that she intends on mistreating Jewish patients. She intends to give them the wrong medication. How is it possible that she would still have her medical license?
She shouldn't. You can't threaten to harm your patient. It breaks two of the core tenets of medical ethics: do no harm and put your patient's interests first. You know, you can probably be online with all kinds of political views, even hateful views. But the line that you can't cross is threatening to mistreat or commit malpractice against a patient. That should cost her license.
I mean, this is an egregious violation of the Hippocratic Oath, everything that a doctor should be doing, correct?
Correct. It doesn't matter. You know, even in war, we try to treat the opponents. People who've been trying to kill our soldiers get treated if they get injured. We try in medicine not to pay attention to whether someone's a criminal or a nice person. You just go about your business of trying to restore their health. That's what she should be doing. And you make the threats to say, I'm not going to give the right medicines. You're way over the line.
Right. So what happens next in this process? How does her medical license get revoked? Because you can't have someone like this treating any kind of patient, I would argue, if this is her disdain for Jewish patients wanting ill health for them.
Right. So you may find out that maybe she has mental illness, maybe something's wrong with her that might exculpate her. Short of that, I think you'll see charges brought. It'll have to be done in Ohio. I assume that's where her license is. And a board will convene, look at the evidence, and render a judgment. Boards are conservative. It may be that they only suspend her license for 5 years and send her off for some education. It's possible. I'm not sure I would agree with that, but that could happen. But I think we'll see claims filed against her in the state of Ohio by patients. Actually, any citizen can bring it to the attention of the medical board there that controls licensing. And I'm pretty sure we're going to get at least a forfeiture of license for some significant period of time.
One would hope so. Now, you raise an excellent point about her patients. What happens to her past patients, the patients that were under her care, and I use the term care very loosely here? Should they now be reviewing their medical histories, what they were prescribed? Could they be in a problematic health situation now?
Well, I think the clinic, the Cleveland Clinic where she worked, has some responsibility to back check those records, make sure the notes and everything seem to be in order. If you knew that she was your doctor, I would go to a different physician and just have my prescriptions checked, have my treatment plan checked, just to be sure. I do think, though, the clinic has responsibility to make sure that everything looks correct in their records.
You know, Doctor, the Cleveland Clinic is considered one of the most distinguished and selective organizations in the medical world here in the United States. And here we have a woman with an extensive history of anti-Semitic remarks dating back from 2011, where she called for violence against Jews, called Jews dogs, minimized the Holocaust, praised terrorists that kill Jews. How does someone like that get accepted in the first place?
Well, you know, medicine really does not screen people for their private political views. You might think that they just go online and take a check of what's been up on Facebook or what's public on Twitter. Probably not, not at the residency level. They'll get letters of recommendation. They'll ask people for competencies about someone who wants to be basically a worker at the hospital post-medical school. But the detective work that would sort of reveal someone's hateful views, or somebody's biases or discriminatory views, you might catch it, you might not. I'm not usually surprised that she was able to maintain, if you will, a kind of secret life on the internet without the medical establishment really getting in there and figuring out that she had this secret life.
Well, the organization is saying that the system is now discussing looking at potential employees' social media history going forward. Dr. Arthur Kaplan, it may be time. It may be time indeed. We're out of time for this segment, though. Thank you so much for joining us. Appreciate you being on the show. All right.